Good afternoon. This is Julie Hibben with the Iowa Department of Public Health, and we want to welcome you to the last technical assistance call for the Integrated Provider Network on the Strategic Prevention Framework. So thank you for being a part of this call today. Just a couple of reminders before we get started. We will be recording this call, and we will make sure that the recording is available on the Integrated Provider Network webpage. And any resources like PowerPoints will be also available on that same webpage, usually 1 to a couple of days after the webinar occurs. We will ask you as well to make sure that your lines are muted. So you can mute your line by clicking on the little microphone next to your name, or just muting your line if you're calling in. We would appreciate that so we can cut down on background noise. And lastly, I just really encourage you to participate today. If you have pressing questions about the Strategic Prevention Framework, this is the time to ask. So please either participate through the chat box or unmute your line. You should have the capability to do that. So I will go ahead and turn it over to our trainers, Lori Barger-Sutter and Mary Ellen Shannon. Thanks.
Well, good afternoon, folks, and welcome back. We are thrilled that we could do this series with you, and we've really had a lot of fun this week. So we appreciate everybody's participation and your time. I especially want to thank Julie Hibben and IDPH for their time and support throughout this series, and to all of you. I know your time is valuable, so hopefully you found this a worthwhile investment. Before we open up the webinar for your questions and discussion, we thought it would be good to spend just a little bit of time talking about cultural competency and sustainability. These are two components of the Strategic Prevention Framework that we've touched on, but we haven't really talked about them explicitly. So we will share a little bit of information, but of course we want you to participate in discussion, and we will absolutely make sure we get to everybody's questions. Also, just want to mention that later today we're going to be providing IDPH a resource guide that includes the information that we've presented through this webinar series, and it also includes copies of some of the forms and tools that we've highlighted in our PowerPoints. As Julie mentioned, please do use your chat by just clicking on your chat icon to participate today. We've noticed we've had a little bit of feedback when folks unmute their line, but we think we can manage that if we have one person at a time. If you want to talk or say something, we think the feedback could be minimal if you just hit that unmute button, and we do that one person at a time. Finally, as just a friendly reminder, we will be sharing some tools and using some terminology today in our discussion, and the Iowa Department of Public Health is still finalizing their processes that will be required of its contractors. So the tools we are using, the terminology we use, is for demonstration purposes only, and they may or may not reflect the final specific processes adopted by IDPH. So with that said, I'm going to turn things over to our lead presenter, Lori Barger-Sutter. Lori?
Thanks. Thanks, Mary Ellen. I thought I was on mute, and I had to go, and I wasn't. So as Mary Ellen noted, we didn't explicitly talk about cultural competency and sustainability because to us it's implicit in the way that we approach the SPIF and the way that we work with communities to adopt it. But as she said, we thought it might be worthwhile to spend some time talking specifically about that. The last session we were together, I crosswalked the mobilizing for planning and partnerships framework that public health uses, that's funded by CDC, with the SPIF framework from SAMHSA. And and we talked about how similar they really are. One of the places where I think the MAP framework might be a little stronger is in its kind of intentional discussion of cultural competency as a function of promoting health equity. That's kind of cultural competency with a specific purpose. And so I've just pulled out some from the MAP Users Handbook, how they talk about health equity and health inequities. And that user handbook will be something that we'll be providing to Julie for anybody that's doesn't have it and would like to see it. So that really starts that cultural competency with a lens towards health equity, of course, starts with the assessment process. So as you're looking at rate and prevalence and incidence and burden, it's with an eye toward not just population overall, but looking for those patterns and anomalies within certain populations, using your data to cross-tabulating your data to see what you can tease out about what populations and what areas may be experiencing disproportionate health issues. We talked about contextual conditions. I always think of this as really knowing the contextual conditions of the area that you're serving is the heart of a culturally competent orientation and response. And then we talked about intervening, 3 different types of intervening variables, including environmental. And of course, these all can have significant impacts on not just populations overall, but populations that may be experiencing disparities in health issues. So we thought we would take use the chat box and I'll lean on Mary Ellen as always to be the hostess of the chat box and just see, we're curious to know in these areas, environmental examples, are there particular things that you're seeing in your communities or the communities that you work in that are resulting in disparities in health and well-being among certain populations?
So again, we'd like to hear from you so that this could be an interactive webinar. And again, if you don't know where your chat is, just kind of run your cursor over the bottom of your Zoom window and you'll see there's a chat bubble icon there. And you can just click on that and that will open it up. It looks like higher density of tobacco outlets in lower SES neighborhoods is one.
Yeah, that's a good one. I mean, that's not a good one, but that's an excellent example.
Higher density of alcohol and proximity to schools.
Yep.
Also more alcohol retail stores in downtown areas that are closer to the University of Iowa.
Mm-hmm. Mm-hmm. Okay, let's take a look at this one. We talked on one of our first coaching call. We kind of got into a discussion about social determinants of health. How about these? What are you seeing in your communities that have an impact on health or health disparities? What's happening in Iowa?
So we've got a few more that we're trickling in from before and maybe even carry over into this one too, Lori.
Okay.
Is gambling opportunities on and off casino.
Mm-hmm.
Small towns where law enforcement isn't always present to enforce. The judicial system, Native youth are present more than the proportion of crime to that population. So that's just some carryover from the previous one.
Oh, that's good. Yeah, that's good. I've actually been working with the state recently, and they're actually mapping, they called it disproportionate minority contact with law enforcement, and they've actually come up with a way that they're capturing that as a data point. It's so interesting.
Absolutely. And then we're hearing now that there's some language issues, access to transportation, discrimination, language literacy, discrimination and access to transportation.
Okay. So it sounds like these resonate in Iowa.
Food and affordable housing, absolutely.
Yep. Okay. And I think I heard some things that began, some of the things that started generating sounded like they also had a relationship maybe to some system issues. So what do you see in Iowa with regard to systems level issues that are impacting decisions about resources and promoting or at least not resolving health inequities?
Trust.
Mm-hmm. And I see separate is not equal, communication and funding. Okay. So it sounds like these all really resonate with people in Iowa, certainly things that you're seeing and working with. I wanted to talk a little bit about sustainability planning too. Now, I believe, because I've seen the power of really developing excellent problem solving skills and how that inherently positions organizations and partnerships and coalitions for sustainability, because when you become known and you can document your abilities as problem solvers, then funders want to invest in you. I've seen this over and over again with coalitions, and being able to really, or organizations diversify their funding and develop a really rich portfolio, because they not only become good problem solvers, but they are able to demonstrate that in multiple ways, from the ways that they seek funding to the ways that they document their outcomes. So we worked with a group that once existed and sadly no longer does, called the Finance Project. It was a nonprofit technical assistance center that was its business was helping coalitions and organizations, primarily in the nonprofit and community-based organization world, do sustainability and strategic finance planning. And these were the principles, the factors that the Finance Project came up with as being foundational to sustainability planning. And they probably hopefully they look a lot like what we've been talking about to you, having a vision that moves people, having a results orientation. So it's not just about implementing the strategy year after year, but it's getting the result. And that means strategies may need to change. And in our sustainability framework, it's all about sustaining outcomes, not necessarily services. We want to sustain the outcomes, so we know that the services or the programs and policies may have to change over time as we're pursuing those outcomes. Adaptability to changing conditions, broad base of support and champions. We've talked about that. We talked about strong internal systems during our capacity assessment discussion. So the Finance Project also came up with a key elements of a sustainability plan. And it looks a lot like a business plan. It looks like something that organizations can pull from to provide information to funders or to their stakeholders, and it can also be used to present in its entirety to funders or stakeholders. And the components are an executive summary and overview that kind of tells the story of the organization or the partnership or the coalition, and then presents a finance plan that says, here's exactly what we need, and here's our strategies for securing resources. I've talked about Mary Ellen and I's work for SAMHSA doing reviews of different, of all 50 states and 10 federal jurisdictions. And it was very common for us to hear from state agency staff, there's just not enough money to solve these problems. There's not enough money to make a difference. And so I would always say, so how much do you need? And that would usually take people aback, and they'd say, well, I don't know. And then I would say, well, then how do you know you don't have enough money now? And what would you do with that money? So a strategic financing sustainability plan positions you to know exactly how much you need and to have strategies in place for securing those resources. And I pulled and lightly fictionalized an example of a strategic financing plan from some coalition work that happened in Nebraska. So this is old, but I think it may be useful and interesting to some of you if you've not been exposed to this kind of strategic financing planning. So it really starts, these are the appendices. So this is the information, the process that coalitions, organizations work through to come up with the section of their plan that talks about financial needs. So it all starts with knowing your outcomes, right? What you want to, what kind of problems you're working to solve, and then figuring out, okay, so what are the key strategies that have to be sustained or implemented in order to achieve that outcome? And so we've got those, just strategy A, B, and D should be a missing C there. And then looking out over a 3-year period and really thinking through, okay, do we need to, what's the scale that we need? How many sites do we need to have? What's the range of activities? What are the target populations? So again, this is a lightly fictionalized actual plan where this coalition is thinking through, okay, in this first year, for this strategy A, we don't need to expand the sites. We've got our geographic area covered, but we do need to increase the range and scope of activities, and they've set themselves a 50% benchmark and the assumptions of how many students are going to attend each session. Not going to expand the sites in 2021-22, but they are going to try to increase the number of sessions in Alpha City, and then in 2022-2023. So and then you get the idea, and then they're going to reevaluate at the end of year 3 to decide whether they need to adopt a new curriculum or they need a community mobilizer, which would be more appropriate. So I think what's useful here, in addition to this process, is looking at the activities to be sustained. So going down, reevaluate at the end of year 3. Strategy B, they're saying this is a really important strategy. We see ourselves continuing this indefinitely in partnership with Agency A. And then on strategy D, we see that they're really looking at, this is not the best fit for us. It's the community likes it. And people don't want to see it go away, but it didn't, in this case, it didn't have a really strong, I talked about effect size. This particular strategy was very popular in the community, but it truly didn't have a terribly large effect size with regard to reducing substance use. And so their planning for this was looking for resources and looking for a place to land this program in the community. And then at the end of year 3, they say we're passing the baton, that by 2022 to 23, we're going to have found a place that can continue to do this program that's liked, but isn't producing specific substance use reduction outcomes. And so having done that, looking at the scope and scale, then the next step is actually that budgeting to say, okay, so at the recommended scale of implementing this program, and again, these figures are 10 years old and they come from rural, very rural part of Nebraska, so not a lot of money. But at the recommended scale, what kinds of staffing do we need? This is mostly looking at staffing. Some programs, of course, are going to have materials, maybe food, consumables, different things. And so what are the available resources? And then what are the gaps? And then they're projecting it out 3 years and applying cost of living increases or whatever they have, and then identifying where the gaps exist. And then looking at potential funding sources for financing these strategies and looking at the current, so this strategy A, the current source, they've got a federal grant that is ending. The schools can't step in and pick it up on their own, but there's a low number of youth served. So they're kind of doing a plus and minus analysis, and then they carry it over. And again, this is their actual thinking here. They're looking at future sources of funding, and they're doing, federal grant, different federal grants. And, first one has a short time frame, might be cut by the feds, positives if it's their guidelines, has a good track record. Federal grant D, it's just a negative. There are too many restrictions and too many requirements. They're looking at tacking on a fee and how they might do that, the pros and cons of adding a fee to this particular program, looking at corporate sponsors, discounts and sharing funds with food and restaurant vendors, looking beyond businesses that provide products to looking for sponsorships, local foundations, United Way. What I really liked is, the thinking, seeing the thinking that went behind this, and then being really very thoughtful about not just chasing any pot of money, but being really thoughtful about where does it make sense? What are the pros and cons of going after these funding streams, including looking at how long they would be available for. And so then I really like this one, the future funding strategies. So they're taking these strategies or these funding sources that made the cut in the exercise we just looked at, Appendix C, and they're putting them through a more scrutinized lens. They're saying, so how much money would this get us? What's the administrative burden, which I think is really smart. Think about how much time is this going to take us to do the application versus something that might only require a letter. How soon would we get the funding if we were awarded? They're looking at, does it diversify our portfolio? And this particular coalition was a Drug-Free Communities coalition. It was actually a county-wide coalition that had drug-free community fundings and a lot of federal funds. And so they were looking to diversify and strengthen and not be so reliant on those time-limited grants. Can we use, this is a really important one, can we use this source to meet the specific needs that we need to meet as opposed to meeting the needs of the funder? They thought about the political considerations that would be associated. And then at the end would be where they would decide this is a priority or not a priority for us to go after this funding. And you can see they were looking at public sources, private sources, as well as other sources. And I really like down in the bottom under other, they are beginning to think about, well, let's develop a list of the most influential people in the community, and involve them in helping us connect with resources, and also exploring that fee for services idea further. So, and then they use the same process, this strategic finance planning, to look at their own organizational development and look at those 7 or 8, there were 8 different areas that we looked at that were the kind of the key elements of strategic planning and financing, strategic financing. And so vision, results orientation, strategic financing orientation. And they're taking the time to identify activities and tasks associated with enhancing their own development in those areas, who's responsible. Timeline looks a lot like our strategic planning template that we talked about on our last call. And just going on, key champions, adaptability to changing conditions, strong internal systems, and sustainability plan. And then I didn't populate it because this is so very similar to the strategic planning template that we went over in detail on our last call, but it would be the same thing then for these different strategies. They would lay out an implementation plan. So what are the key activities and tasks? Who's going to do them? When are they going to need to be done by? And then a place to check off the actual date that they were done. So it becomes not just a plan that sits on a shelf, as so frequently happens with strategic plans, but a plan that actually has a management component built into it. So you know exactly what you need to do to implement it. So let me pause there and see if there are any questions or comments or discussion on cultural competency or strategic planning, or not strategic planning, sustainability planning.
And Lori, right now we're seeing the Zoom window and the participants, the chat.
I don't know how that happened. Okay, there's it back.
It's back. Good job.
Yay. Okay.
So, any questions about it? I know we're going through a lot of, I guess, rich and deep information. We're just kind of skipping across the surface of it, just to show you a concrete example of what a sustainability plan could look like. And again, this is not something that IDPH has adopted or will require. It's just an example from our work with other states and communities that we're sharing with you. And an example of a good one that will help somebody really actually sustain the outcomes that matter most to them. So any questions or comments about the either cultural competency or sustainability? Anything we've shared? It always takes a minute, folks, to translate into the chat. Doesn't look like we've got any questions coming in. If anybody wants to unmute their line and talk, we encourage you to do so. If it's easier said than typed. Looks like we've given folks a lot to think about.
Okay, well, we'll give you some, we'll give you some more to think about. We generated some questions just in case people were quiet to kind of maybe generate some discussion and get some feedback. So we would love to know. We set out to try to, knowing we had a very diverse group from new to very seasoned. So we tried to pull together material that we thought would have something of interest for virtually everyone, and maybe hopefully I always like things that are new to me or make me think in new or different ways. And so we would love to hear you know, what, if anything, in the content of the webinars was new or interesting, or, you know, gave you new ideas about how to think about or approach your work.
This doesn't have to be from our webinar today. This is from the entire series. You know, from our webinar on Monday that had to do with assessment and mobilization and building capacity. Even our coaching webinar that followed.
Yeah, and somebody sent the book, Mary Ellen, and that was Switch by Chip and Dan Heath. And I think the subtitle is How to Make Change When Change is Difficult, but Switch by Chip and Dan Heath.
Great. Yeah, that didn't come through on my chat. Terrific. I'm glad you're seeing that.
Okay, additional assessments and data resources. Is that something that you're looking for more information on, or that you liked the information that was presented? Like the info presented.
Like the info.
Great.
And I thought too, it was nice to review what we need to do and what will give us a starting place for where we can go from here. Good. I think it'll be more relevant when we get the deliverables from IDPH to put these into practice. Absolutely, understood. And I know Julie is working so hard on her end. Having worked at the state myself, there are a lot of things you need to go through before you can roll out, you know, new practice and documents and all of the support that goes with that. So appreciate Julie and all the hard work that she's doing to support you guys in this practice. And that's one of the beauties too of having a recorded webinar is you can look back and listen to the recording and go through the resource guide and PowerPoints. Revisit that when it is so relevant. Cheryl says ditto, and thanks, Mary Ellen, sure.
Okay, so so granted that you don't have your exact deliverables yet, is there any additional information or advice or support that would be useful to have with regard to assessment? Okay. What about mobilization capacity building? That was a big topic on our first coaching call. Okay. About strategic planning. We'll just go through these and give you all a chance to think if there's anything else we can do for you in this last call. Okay. How about implementation or evaluation? Okay, well, that brings us back to where we started, which was cultural competence and sustainability. Any comments or questions about what we talked about at the opening of this? Okay. All right, well, that takes us to our last question. Is there anything related to the SPIF that we haven't addressed that you'd like to talk about? Well, Julie, is there anything you would like to discuss or have discussed on this call? It sounds like people are in a good place with the information.
Well, I'm glad. I hope that is certainly the case. And we do have a lot of expertise around the table in this grant and folks who have experienced SPIF in a lot of different ways in their prevention work. So, and I'm just thankful for the items that both Lori and Mary Ellen have brought up on these calls, and I do hope it's helpful to you. I know it's hard sometimes to envision how this is going to look in this specific funding stream, and right now, probably many of you are just thinking about setting the foundation for this work as you're moving ahead. So even if you do have questions more about who needs to be around the table. I know Lori mentioned that on the last technical assistance call, that not everybody has to be at the table when it comes to every step of the SPIF. And there may be some expertise that you need to bring based on a specific item that you're focusing on. So I know that's one item to be considering moving ahead, and thinking about how you can also address some of those differing priorities that are happening in the counties that you serve, and where does this specific project fit in. I know that's a discussion we've heard quite a bit, either on these calls and also offline when you've reached out to us for technical assistance as well. So I'd really just encourage you to keep thinking about SPIF through the lens of this project. Think about your past expertise that, and the lessons you've learned in SPIF work before now, and thinking about how you can really set that foundation in a very solid way as we move ahead in IPN. So if you do have specific questions and maybe about some things that have bubbled up for you over the last couple of webinars, this would be a great time to bring those things up. If you're curious about how something could look based on a specific situation you have in your service area, that could be another item to discuss. So those are just a few things that come to mind.
And one participant mentions that all of the training, and I know that Julie, you provided training in person too, but all of the trainings and the area that trainings have been in are very helpful. And Cheryl feels ready to go, which is terrific. That's what we want, folks to feel ready to go and to take, on your next step, whatever that is, wherever you're at in your planning. We want you to feel confident in that you've got at least a good sense of the resources that you have available to you to draw from. And I have to tell you guys, it's pretty unusual that you have a bureau chief, somebody that works at the state level that is willing to come out and to just kind of make themselves available by phone call or just to talk through things with you. So that is a fabulous resource. We don't see that in every state that we work with. So that's an absolute resource to you guys. I'll just mention, if we don't have any questions or comments or dialogue, certainly there's no reason, Julie, we don't have to spend our full scheduled time here. If folks feel like they've got what they needed, that's terrific. I will just say that, the information and the resources that we're providing to you, Julie, if folks get out in the field and, they're working in their coalitions and communities and they've got questions, or they, really want to use a piece of information with their coalition, they're having trouble with it, please do reach back out to us. I work here and live in Illinois. And Lori lives in Nebraska. We would love to continue to work with you guys. We are your neighbors, and we're happy to be a continued resource as you actually begin to take what's theoretical and kind of, you've probably gotten a lot of information and gotten a lot of forms and tools, and all seems kind of theoretical right now. And then I know it seems very different than when you take all that you've learned and put it into operation. That's where things can really get tricky. So please do reach out if you've got questions or need some assistance. We would be happy to talk with you and work with you. And you can just reach out through partnerwithus2019@gmail.com.
Well, thank you both for all of your assistance, and thanks to all of our IPN contractors for going through a lot of trainings during the month of September. We hope they've been helpful and really do appreciate Mary Ellen and Lori's time as well. And we certainly hope that this is not the last time we see them. You may be seeing them again in the future. So thank you for participating today, and have a great rest of your day.